Welcome to Homewood's Eating Disorders program. For more than 2 decades now, we have specialized in the treatment of anorexia nervosa and bulimia nervosa. We welcome you to our new unit, which is designed specifically to accommodate the needs of eating disorders patients.
Homewood's Eating Disorders program specializes in treating both men and women aged 16 years and older. The program is voluntary and client-centered, focusing on the physical, emotional, social, and spiritual aspects of the patient. April Gates, program coordinator, believes Homewood's Eating Disorders program has many distinctive features that set it apart from other programs in Canada.
One of the advantages of our program is its size. As one of the largest eating disorders programs in Canada, our comprehensive interdisciplinary treatment team is able to offer patients a variety of treatment options. The treatment team consists of nurses, psychiatrist, a physician, a psychologist, social workers and a family therapist, a dietitian and diet technician, a recreation therapist, chaplain, an occupational therapist, horticultural therapist, students from a variety of disciplines, and volunteers. We often hear that patients really appreciate the fact that they are with like-minded co-patients, people who have also experienced eating disorders. Oftentimes in outpatient treatment prior to coming in, they may have met individually with a therapist or a dietitian, and they haven't had the opportunity to learn from one another and feel that they're not unique or different, that they have a common illness that they share, and they can heal together. And we always say you heal in community, not in isolation. We are also able to address coexisting conditions in our patients, providing support and therapy to those diagnosed with additional psychiatric or addiction issues. The Eating Disorders program at Homewood uses best practice treatment approaches and enhanced cognitive behavior therapy and dialectical behavior therapy. Together, these methods teach patients adaptive coping strategies to meet their needs and enhance their quality of life. Patients develop important skills in identifying and managing their emotions, tolerating their emotional distress and reducing vulnerability, which previously led to eating disorder behaviors, learning effective interpersonal skills that help manage conflict and define healthy boundaries, mindfulness training that involves managing one's attention, motivation enhancement strategies that assist and encourage full participation in one's own recovery process. Most treatment is group-based, although some individual counseling is offered. Patients are very excited about the newness of the unit, for one thing. It's a very Zen-like, peaceful, calm environment. The patients are enjoying the outdoor garden space that we have with a fountain that actually changes colors with remote, and just the visual aspect of being able to look out of the lookout lounge, we call it, and see the trees, and nature is right at their back door, basically.
During the time they're in the Eating Disorders program, patients are expected to stop their eating disorder behaviors in conjunction with learning new skills to manage urges and emotions, take responsibility for the recovery, develop personal goals for their treatment, and be open and honest, putting an end to secrets which often drive the eating disorder. The length of the program is tailored to each patient based on their individual clinical needs. Patients with bulimia generally remain in the program for an average of 12 weeks. Patients with anorexia often stay longer if additional time is needed for weight restoration. Patients begin most days at 7 a.m. Once or twice a week, they attend a weigh-in prior to breakfast. For the first few weeks, all meals and snacks are served on the unit and supervised for up to an hour afterward. Patients are expected to fully complete each meal. Further into the program, patients eat meals unsupervised in the patient dining room. During the day, patients participate in groups. Evenings and weekends are free, a time to socialize with other patients and visitors, complete homework assignments, and to practice healthy behaviors.
Families and other support people really appreciate the opportunity to be involved with the patient as they progress through the program. We offer family therapy with our 2 family therapists on the team, and that can be done by phone or in person or even over Skype on the computer. We also offer Family Day, which is a wonderful opportunity for family members to get together and share experiences living with an eating disorder and how it affects the family unit, and also to gain some skills on how to manage and how to support their loved one in their recovery. Many patients come into the program expecting the program to just deal with eating or just deal with curbing compulsive exercise patterns. But there is so much more to the program than just eating and exercise. We help patients learn how to identify their emotions and express their emotions, and how to be assertive with one another and develop healthier interpersonal coping skills and learning how to set boundaries. And I think that goes beyond what a patient expects coming in the doors. Many patients who complete the eating disorders program consider their time at Homewood to be a life-changing experience. The majority of patients demonstrate improvement, particularly in the behaviors and characteristics that are closely associated with eating disorders. Close to 95% of patients surveyed say that they were helped by the program and would recommend it to others needing treatment. For more information about our program, the referral process, and program outcomes, please visit our website at homewood.org.